coming up.
I think that trying to guess what that number might be, I imagine that you have
once
some
again,
figure.
you have no clue. That's
No,
what you're telling
I would
Canadians.
say, Mr. Chair, I'm not here to play Jeopardy with you. If
So
you have
clueless.
these questions where you
really
have an
have
answer,
no idea.
We need community-based doctors, Minister. What analysis did Health Canada do on these proposed tax changes before moving forward with this reckless implementation?
This guy's garage. Like and subscribe.
Government operations and estimates, or as the PBO calls it, the mighty OGO.
Minister, thanks for being here. Perhaps you could tell us, we tried this questioning before, but how many Canadians don't have a family physician?
Well, as I indicated before, it's difficult to get an exact number. There's between 12 and 14%, but again, it's difficult to know with precision.
Just the number,
perhaps,
perhaps, Minister. How many?
Well, as I've indicated before, it's impossible to give an exact number. I'd say in a ballpark range would be between 12 to 14%.
Yeah. So are you telling Canadians out there that you, as the Minister of Health, really have no idea?
What I'm saying is that the health data, which is collected by provinces and territories, is not as clear as it should be. That what we get from provinces and territory leaves some ambiguity, and as a result, we are best left to speculate as to what that number would be.
Thanks very much, Minister. So it really is 6 to 7 million Canadians without access to primary care. 6 to 7 million. How many doctors will Canada be short by 2028? This is recent stuff. I don't know if you've read it, but it's important numbers. You could share that with Canadians.
Yeah, and I would say that, and I would posit to you, if you're going to advance deep cuts to the health system, then that number is going to grow exponentially. It's incredibly important not to allow cuts to occur to our health system. We've signed.
Thanks, Minister. I didn't say anything about cuts. I asked you for a number. How many doctors will we be short in this country by 2028?
Well, I'm not going to engage in a hypothetical. I think that trying to guess what that number might be, I imagine that you have.
So once again, you have no clue. That's
no,
what you're telling
I would say, Mr. Chair, I'm not here to play Jeopardy with you. If you have these questions where you have an answer,
no idea.
No, because frankly, it depends upon what happens in the next election, Mr. Chairman.
44,000. So
no, but that's
what your government has done
number.
is increase taxes on health care. The capital gains changes. Comes into force next week. How many more Canadians will be without a family doctor based on these changes?
Having a more fair and balanced tax system where doctors still have.
I didn't ask you about taxes. I asked you how many more,
well,
and maybe you're having trouble hearing, but I can say it again for you. I'll say it slower. How many Canadians, because of your tax changes, will be without a physician?
I would say that the menace to our health system is the cuts that you would propose to it. It is not a more fair and equitable tax system that asks those who make the very most to pay a little bit more so that we can have a safe and secure health system.
Just the number,
if you
Minister,
want the
how
opportunity,
many more Canadians will be without a physician because of your tax increases? How many?
I reject the premise of that question. I think that what is a menace to our health system is the cuts that you would impose to that system. That a doctor still has huge advantages under our tax system
so as
to be
we
able
said,
to
Minister,
use
right now,
incorporation as a tax deferral
6
vehicle.
million Canadians don't have access to primary care. How many more, when you increase taxes, will not have access to a family physician? These are not hard questions.
Well, they are because they're not rooted in reality. Look, you have some bizarre thing you're doing. I don't know what you're doing. I'm trying to answer rooted in reality. The reality of our health workforce crisis is the investments that we're making to both accelerate foreign credentials and other forms of credentials, and to make sure that. And to make sure in the other instances, well, you're not interested in an answer.
Estimates would say by 20, I'll say it slower for you, because you're struggling, I get it. Estimates would say that the doctor shortage will be 44,000 by 2028.
I reject that. I think the work that we're doing.
Excuse me, Minister, I'm not finished. Just listen. I know it's hard. How much worse will the shortage get when the tax changes take effect? Simple question.
I reject the premise of that question. I don't think it's true or accurate. And I can walk through the tax advantages that continue to remain for doctors, which are very significant, and that the asking for a more just tax system is not the menace to our healthcare system. Your cuts, sir, are. The cuts that you wish to impose upon our healthcare system are a clear and present threat to us not being able to ensure that people have the healthcare work that they need.
You know, Minister, the fascinating thing is you keep talking about cuts, but what I keep talking about is the tax changes, the tax hikes that you are. Did your government complete an analysis on the tax hikes before implementing the change?
So asking those who are making more than $250,000 from capital gains.
That's not what I asked you. I said,
I don't agree. Look, I'm not here to play your bizarre game. I'm here to try to answer questions rooted in reality. If you want to issue a press release with your thoughts, I welcome it.
If you think the Canadians not having a physician is a game,
then
you're in the wrong job.
I think that
you are in the wrong job.
I think cutting dental care, cutting pharmacare, cuts
so
to
I guess
health
the
care,
question is, Minister,
those are the things that are menacing our health care system, asking for a more equitable tax
Are you
system.
really going to just never answer any questions? Is that your plan? But the question really is, did your government complete an analysis on the tax increases before you implemented the change? Yes or no?
I think the analysis of the tax changes demonstrate very clearly that we're asking those who have made an extraordinary amount of money through capital gains and had an incredible last 5 years to pay a little bit more,
Minister,
so that a nurse isn't paying a higher marginal tax rate
Minister,
than
the question
somebody else.
is, did you complete an analysis? Did your government complete an analysis on the tax change? Yes or no?
And I've answered that question. There is absolutely an analysis done to make sure that this is more equitable and more fair.
If you did, then please table it with the committee. I'd love to see it.
I have a point of order from Ms. Kayabaga. Go ahead. Thank you so much. First, I just want to say that I could barely hear folks in the room. If they could increase the sound, would be great. My sound is pretty high. I'm calling a point of order because the minister is here to answer questions. Like, if he is asking him questions, like, give him time to answer questions and not speak over him. It's really hard to even hear what they're saying when they're speaking over each other like that. So if he's asking a question, I would say that it would be great for us to hear the answer as well.
Thank you, Ms. Kayabaga. What we try to do here is allow the person answering the question to have as much time to answer it as was spent posing the question, and we've come to learn that's exceptionally difficult, but it's also the fairest way that we can do it. So thank you for that, Mr. Doherty. Did you have something you want to say on the point of order?
Just only to say, Mr. Speaker, and to our colleagues that are in there, you're coming through crystal clear on my end. Both the volume is loud enough, and it's very clear. So it might be to Mrs. Kayabaga's question. It might be on her end the issue.
It could be two people talking at once as well. Okay, Dr. Ellis, you have 25 seconds left for the question and the answer, and you have the floor.
Great, thank you, Chair. So perhaps one final time for you, Minister. I'll say it slow again because you're struggling, I know. But did the government, or Health Canada, which is part of the government, complete an analysis on this government-funded, government-implemented capital gains tax hike before implementing the change? And if so, could you table it with the committee, please?
Well, insulting me isn't going to help ameliorate the answer. The answer is that, yes, we've looked at it, and it was very clear that a nurse shouldn't be paying a higher marginal tax rate than a multimillionaire, and that asking folks who've done exceptionally well in capital gains over the last number of years to pay a little bit more so that we can have a healthy, stable health system, I think makes a good deal of sense. I understand your ideological opposition to it, but personally insulting me doesn't improve your argument.
Thank you.
Thank you, Mr. Chair. So the Canadian Medical Association said that the tax increases will, and I quote, jeopardizes the stability of our struggling healthcare system. The risk of an already overstretched physician leaving the profession or reducing their hours in response to heightened taxation is real. Do you disagree with the Canadian Medical Association?
I do. So there's a couple of really important tax benefits that are retained. One is if you incorporate, you still have the opportunity to shield, and unlike an RSP, there's no limit to that. So you can shield in an incorporation your gains and allow them to compound upon itself. And secondly, when you remove money, you continue to enjoy a capital gains exemption. So it will move from 50% to 1/3. But if, again, the important point here is a nurse who is...
To quote from the Canadian Medical Association yet again, and I quote, given the current economic climate, the tax changes coupled with a housing crisis and rising student debt will also impact young physicians and medical learners who find themselves in a much tougher financial position than they would have been in 10 to 15 years ago. This will create another disincentive to becoming a community-based doctor at a time when there is a grave shortage, end quote. We need community-based doctors, Minister. What analysis did Health Canada do on these proposed tax changes before moving forward with this reckless implementation?
Well, we absolutely need community doctors. That's why we're investing in doing exactly that with provinces and territories. And if you're a young doctor starting out, you're not sitting on large... Sorry, Mr. Chair, I don't believe that there was an equivalency of time there,
That was
Mr.
about a
Chair.
40-second question and about a 4-second answer before you interrupted there, Ms. Goodrich. Go ahead. You got another 30 seconds to answer that question.
Thank you, Mr. Chair. So if you want to get a young doctor doesn't have huge accumulated capital assets. Like, we're not talking salary here, we're talking capital assets. In the last 5 years, those people who had the money to have capital assets have made an extraordinary amount of money. And asking them to pay a little bit more, I think, is fair. You know who hasn't made an extraordinary amount of money on capital assets? Personal support workers, nurses, right? Plumbers. And those folks are looking at the marginal tax rate they pay and saying, why should I pay a higher tax rate than somebody else? I think that's unjust. And I think having a fair system allows us to make the investments that we need in our healthcare system.
Respectfully,
Minister,
I appreciate that you think that you can just talk over everybody because that's what you've been doing so far, but I'm going to say that this is my time. So I've asked very specifically, what analysis did Health Canada do on the number of doctors that would flee our borders and go practice elsewhere as a direct application of implementing these reckless tax changes?
So I've just explained that I see no such evidence of that, and that the equity that I just stated is very clear. Asking a nurse to pay a higher marginal tax rate
thank you,
than a
Minister.
millionaire
So are you saying
fair.
that Health
And so we need a
Canada-
fair tax system, and we need to make investments in our healthcare system, and we need revenue to do that.
Again, this is my time, not yours. So are you saying Health Canada did not do any impact analysis on doctors that would flee because of these tax changes, yes or no?
Well, I just said that I don't believe at all that there's any evidence.
I didn't ask what you believe. I asked if there was
again, you're criticizing me for
analysis.
talking over you, but you're the only one talking over somebody.
Point of order,
with all
Mr.
due
Chair.
respect.
Yes, Ms. Sidhu, a point of order.
Mr. Chair, interruptions are incredibly difficult to our interpreters too, because we all want to listen. Thank you.
So go ahead and answer a brief answer, please.
Well, the brief answer is you've concocted a narrative, and you're looking for evidence that doesn't exist for the narrative. If you want to know what menaces our health system, it's cutting dental care, cutting pharmacare, cutting health care.
So,
that's what's going to menace our health system.
So effectively, Canadians get to hear it, that there was no analysis. This is all based on your beliefs and your hopes and wishes and unicorns, and not actually based on any economic analysis. Or if there is economic analysis, you won't share that with us. You continue repeating all of the same talking points, and yet you will not provide any analysis. So how can we trust you?
I say that if you're talking to a nurse, and you say to a nurse that a doctor will continue to be able to have a tax-sheltered vehicle to shelter and allow their gains to multiply upon themselves without taxation, and then when they pull it out, it'll be taxed at a preferential rate, that is still a major advantage. And I think we have to be able to look in the eyes of personal support workers and nurses and have a just health care
Minister,
system.
I'm going to give you
that's important.
I'm going to give you one more opportunity. Is there evidence, and did you provide any kind of analysis as to how many doctors would leave as a result of this policy change, yes or no? If so, table it with the committee.
I just stated very clearly, your ideological belief doesn't conjure into reality something that you want it to. Having a more equitable tax system is not a menace to our healthcare system. Cuts are. Deep cuts that you want to impose on our health system will menace our health system. That is exactly the thing that we are most concerned about.
Thank you,
the
Minister.
changes to have an equitable health system, I do not agree will menace our health system.
So the menace to our health system is moving forward with policy changes without actually doing any impact analysis as to whether it's going to impact a doctor shortage that we already have in crisis in our country. I truly do not understand how this wasn't something that you would have demanded Health Canada move forward with, but clearly it's something that you're wanting to do. So you claim that there is something. So did you do it by province? Did you do it by territory? Is it all based on your beliefs?
Again, capital gains, anybody who's made capital gains over the last 5 years has done extraordinarily well. Asking people who've made a little bit more to pay some of those extraordinary capital gains so that we can have a health system, so that we can pay nurses, so that we can pay personal support workers, I think is fair and makes sense. I understand your ideological objection against asking those
Minister,
who make the most to pay a
fair?
little more, but that's, I don't share it. And you know, I don't know what more to say to you other than you have a different position than
Ms.
I do.
Goodrich, that is your time.